got a lot of guff from some people, and there's this very.
Can I just start filming you now?
There's this, one of the arguments of the promoters is that it's good for people who are too poor to get dental care and so on. But that question has been approached with studies designed specifically to answer the question whether it's a benefit to the low-income sector of the population, and the answer is no. It doesn't make any. Well, obviously, it wouldn't make any difference because it's not effective. So it doesn't make any difference for anybody, rich or poor. But lately I've added two other topics to my presentation. One is a discussion of the chemicals that are used, which we were just talking about a little bit outside, and the other is the application of the precautionary principle to fluoridation of public water supplies, which really encompasses all these things, but it's a systematic way of deciding on questionable issues for public policy, I can send you things. I've written things on these topics, short and non-technical things, so
That'd be great.
that might be helpful. But I wanted to show you also here are the fluoride agents. So let's see if I have. Okay, here's the material safety data sheet, and this is from a supplier in Canada, and this is what I'm talking about for your contact in EPCOR. This is the kind of thing they should be looking at, and also EPCOR should be interested in the fact that what they're doing is illegal. Of course, the courts will know that but don't care. Right. And the courts haven't very effective means of enforcing their decisions anyway. There have been several decisions in both the United States and Canada which would, confirm the fact that fluoridation is not within the law. Anyway, here, so it's a big discussion, but it also gives you the analysis. You see, physical, chemical properties, and here are the toxicological information, and so on. Transportation information. They usually have a list of the chemicals and their concentrations. But anyway. If you see anything here, okay, this one doesn't give the. In fact, in Alberta, the cities that fluoridate are required to check the content of all these substances that are dissolved in this solution of hydrofluosilicic acid for concentrations at certain periods, periodically. I don't know whether it's 1 month or something. And I think it's not at all clear that that's done by most of the jurisdictions. But anyway, I can try to get you another one of these.
How would I find that study if I just search for the name? Will it come up?
What's that?
That study that you just referred us to?
Yeah.
Can I just search for the name and it'll come up? Like, where is that located?
Well, or I can send it to you.
Okay, perfect.
You want, let's see, let's make a folder here for things that you want me to send you. And, okay, and I'll send you this one. Now what is this? This one may
And this is the MSF.
Oh, here are the ones with the compositions, I think. This might be the better one. Potential health effects. Disposal. No, that'll be the same. Yeah. Okay. So the other one will be. Yeah. Now, here. Anyway, I guess the thing to do is for you to ask me questions specifically instead of my wandering around here.
You know, the story that you were starting to talk about, like about the wet scrubbers and all of that, if you can kind of, because that's the part that people always ask. And like I didn't know until just now, like when you're saying that it used to be wastewater, I didn't know that because I thought that it was still wastewater. And one of the things that have come up in my research is the question of, well, you know, like how do they make this, right? But also if there's a shortage of industry in the States, like how are they making it? And I've heard that maybe they're even buying it from China, right? I don't know if you know anything about that. But,
yes, I can tell you. Let me go back then to what we were talking about earlier to straighten this out.
But
Because
if you can help explain what it is exactly, that would be really helpful.
Okay. Now, over 90%, probably over 99% of the fluoridation that is done in North America is not done with a pharmaceutical grade agent like sodium fluoride. It's done with either hydrofluosilicic acid or the sodium salt of hydrofluosilicic acid, which would be sodium hydrofluorosilicate. But that is a product, for the most part, of the phosphate fertilizer industry. And it used to be a waste product of that industry, and because it was in the purification of their phosphate fertilizer, they had to get rid of certain things, and one of the things they had to get rid of was hydrofluosilicic acid, because a law had come into effect in their locations due to the fact that there was damage being done by the content of their hydrofluosilicic acid in the ambient air and water. So they process it now with wet scrubbers, and the wet scrubbers react produce a reaction between the water and the contents of these waste from the production of a phosphate fertilizer, and that includes hydrofluosilicic acid. So what the result is, they have a 23 plus or minus 1 or 2%, a 23% solution of hydrofluosilicic acid. And they ship this to various jobbers in North America, who in turn sell it to various jurisdictions, towns and cities that add it to their tap water. So because now it's sold, it's not a waste product that it used to be. It's a byproduct, but it doesn't mean that it's not hydrofluosilicic acid along with all the contaminants. It's still the same stuff. And the contaminants that comes in that solution of hydrofluosilicic acid includes arsenic, which is a known carcinogen, and lead, which is a known neurotoxin and carcinogen, other heavy metals, including uranium, which is, as you know, is radioactive, and other radioactive elements. So it's that's what they put in the water. And to be sure, most of these contaminants are in the water at concentrations that are lower than what is set as a prohibitive limit. You know, you can't have more than that. But they're also contaminants for which the goal of the concentration is zero, because they're carcinogens and have other toxicities and so on. So what we're doing is putting a substance into the water that's adding these things which we shouldn't have any of, and for the use of people to drink and cook with and bathe with and so on. About probably only 98% or more of water is not used for drinking. Most of it is used for bathing and flushing toilets and watering gardens and lawns and so on. So this stuff is largely wasted, even if you were to assume that it's effective for preventing cavities, which it isn't. And so it's a strange process. And the laws in Canadian provinces, and I'm sure in almost all, if not all, U.S. states, have requirements on what can be dumped into used in their water treatment plants, and the regulations are being violated in the process of fluoridation. It's also what it amounts to is mass medication, and that's a problem on several fronts. For one, is its medication of people who haven't given their consent, their informed consent to be medicated. And it is a medicine because, just by definition, any substance that's not a part of an ordinary diet is not a nutrient, and fluoride in any form is not a nutrient. Anything that's given to treat or prevent a disease is a medicine. It's a drug. Also, the various courts have said it's a drug, including the Supreme Court of Canada as far back as 1957. And so that's what is being added. And in all, probably all, or if not all, almost all provinces, including Alberta, it's required by law that whatever is put into the water has to have certification from the National Sanitation Foundation, and specifically under their standard 60, it's procedures that are required for their certification, and that includes toxicological tests. But they don't have toxicological tests. There's no systematic toxicological study of fluoride in any form. And though there are studies of specific associations between ingesting fluoride and certain adverse effects, so we know that it has toxic effects, but there are no toxicological studies in the legal sense that they can rely on. So it's mass medication that violates some of the principles of medical ethics, which require that you have informed consent, which means that the person who's receiving a procedure or a drug has had it discussed with a qualified professional who's required to inform what the purpose of the procedure or the drug is, what the side effects are or might be, and they have to have the right to stop it, the person who's taking it. And so these are things that clearly are not honored in the process of fluoridating a public water supply. In addition to that, there are professional standards for a doctor or a dentist to prescribe something for a patient. They have to have controlled dosage. Well, the dose is not controlled in fluoridation. The concentration in the water is controlled, but the amount of water that people drink can easily vary 20-fold. For athletes, for people who work in warm climates outside and labor, their consumption is obviously very different from the consumption of someone who sits at a desk in an air-conditioned office all day. And there are certain subgroups in the population which drink different amounts of water. Children, and especially infants, drink far more water per unit body weight than adults do. That's not included in the considerations of the people who are advising us to have fluoridated water. And the diabetics, for example, drink more water, and so on. There are other groups that have particular sensitivities to fluoride, ingesting fluoride, aside from how much they drink. But a smaller amount will have an effect on those subgroups, like people with low iodide in their diet, for example. I mean, one of the toxicities of fluoride that is well established is a suppression of thyroid activity. And not only do we have the epidemiological type studies that show that, but we also know the mechanisms, because one of the mechanisms in the case of effect on the thyroid system, for example, is that fluoride poisons the lots of enzymes. In fact, thousands of research papers have been done by biochemists who use fluoride in an experimental situation in the laboratory to suppress particular enzyme activities. So that's a case where the toxicity is well established, and the toxicity that even promoters of fluoridation admit to is dental fluorosis. The promoters often say, "Oh, that's not a problem. It's just a mere cosmetic effect." But you try telling that to a 14-year-old who won't smile, who stays out of social situations because their teeth are disfigured. The mild form, the classifications that you often hear are mild, moderate, severe, dental fluorosis. Those are clinical terms that are used to classify for diagnostic purposes. So when it says mild, that doesn't mean it's mild in terms of what it does to a child's life. Most of the in the United States, which is about 67 to 70% fluoridated in terms of population, over 30% of the population has dental fluorosis. In the age group from 12 to 15, 41% have it. It's true that a smaller percentage have severe dental fluorosis or moderate dental fluorosis, which includes not only white mottling of the teeth, but brown staining and brittleness and very serious problems with their teeth. Those percentages are much lower, like 2 or 3%. But you can't just dismiss the plight of those people who have that problem. Especially when the reason they have it doesn't exist, because they're not preventing cavities from that point of view. So anyway, what would you like to ask me next? Because I'm wandering here.
Oh no, it's perfect. I guess I was just, the fluorosis comments were great, and I found fluorosis people, so I mean, that's awesome.
Yeah. And about the substances, though, there's another point, because the promoters are saying, when we say that they should be telling people that they're adding hydrofluosilicic acid, not just fluoride, to their water, and they say that fluoride is a natural substance. Well, obviously, fluoride is is a chemical in nature, and but it doesn't exist as fluoride except in solutions, because it's a highly reactive element. And the promoters say, well, it's natural. It's not natural when you're using hydrofluosilicic acid. The natural form of fluoride that would show up in the sources of city's water is calcium fluoride. It's not very soluble, whereas sodium fluoride and hydrofluosilicic acid and so on are very soluble. So when you put it in the city's water, it produces less fluoride ion by far than putting in hydrofluosilicic acid. And but the promoters say, oh, you're not swallowing hydrofluosilicic acid, it all dissolves. But that's irrelevant. What's relevant, what counts, is what it is when it's in the stomach. When it's in the stomach, that high concentration of fluoride ion combines with the high concentration of hydrogen ions in the very acidic content of the stomach to produce hydrofluoric acid, which is a very corrosive compound. It's neutral, so it crosses the walls of the stomach and intestines and enters the blood. And in the blood, it's distributed to all organs and tissues of the body. And so that's what counts, not so much what they put in the water before you swallow it, but what it results in when you swallow it. And when you swallow it, if it were calcium fluoride, if it were natural fluoride, a lot of it would never get into the blood. It would be excreted in the feces. But in these other forms, it gets into the blood, and most of that, the excretion that is excreted from the body, is excreted through the kidney. About half of what you swallow is excreted through the kidney. The other half is just sequestered in various tissues and organs in the body, mostly in bone. By the way, bone is the site of two fairly well-established adverse effects. Fracture is one case, and osteosarcoma is another case. That's a cancer of bone, which is often fatal, and it's the cancer that took Terry Fox. So it affects boys and young men, and we have some idea of how the mechanism goes on that as well. It's a rare cancer, and so it's hard to establish, with certainty. But there's one very good study that follows on several earlier ones that have brought me to the fairly definite conclusion that it's caused by the ingestion of fluoride. The promoters claim that that's been refuted by a newer paper, but the newer paper, even the authors admit in that paper that has nothing to do with that earlier study that showed the strong evidence that I'm thinking of. I don't know whether these promoters don't read the papers, or they just don't understand them, or they are keeping it a secret. But it's an example. I mean, I've heard medical officer of health in Alberta Health Services make this same either mistake or deliberate misrepresentation by saying that this paper that showed the association with osteosarcoma was refuted by this newer paper, which has nothing to do with it. The newer paper, aside from whether its design is capable of answering the question, which it isn't, is it's a horror in the terms of design. It's a ridiculous piece of work. But I don't know whether this medical officer of health read it or not. If he read it, he must not have understood it. And those are the people that city councils and town councils depend upon for advice, and they're not doing their job, to put it mildly. So where were we?
Yeah, I've come across the fluoride issue is great, and the bone issue I've come across, but I've also come across people with allergies which I know is a little bit more difficult, and then cancer, and then brain is the brain issues, because I guess there's a Harvard study that has come out a few years ago, and I was just wondering those three things if you had comments on.
Oh yeah, I've comments. Well, let's say you'll have to remind me again of some of those things, but the part on the Harvard study is interesting. It was during the 90s, a number of publications came to our attention, mostly in India and China, where there are natural levels of fluoride in their water that are very high, and it's a big problem for them in some areas. But there were studies of the possible association of ingesting higher levels of fluoride in the water with lower IQ. We now have 37 studies on this issue. I think 2 of them showed that there was a lower IQ associated with higher fluoride activity. All the others showed that there seemed to be a lower IQ with higher fluoride, either concentration in the water or better concentration in the blood serum, in the blood. So that Harvard study was a meta-analysis. Now, meta-analysis is a formal, systematic procedure for analyzing all the literature on some particular question. So the question was, is fluoride exposure associated with a lowering of IQ? And most of this work is done on children, and the results of the first step in a meta-analysis is to do a systematic review of the scientific literature. So you look for all the papers on this subject, right, on this question, and then you go through them carefully and you decide which ones are good enough in design and execution to be considered. So this group of 3 authors from the Harvard School of Public Health. One of these authors is Philippe Grandjean, who's world famous as an epidemiologist and toxicologist and highly respected. They found 27 papers that they thought were worth including in their meta-analysis, and they went through all the steps of a meta-analysis, and it's a very technical way of combining the data and results from all these different studies and weighting them according to criteria such as the number of people involved, subjects involved in the investigation, the methodology in measuring the concentration of water and all that sort of thing, and looking for confounding variables like whether the 2 populations, say if you're looking at 2 villages in China, you want the villages to be the same in every respect except for how much fluoride there is in their water. And so they look for confounding variables. Might be that one of those villages has a very good diet with lots of vitamin D and so on. The other one has a poor diet with a lack of vitamin D, which affects the condition of the teeth. So you have to look out for those things too. So anyway, the results of looking at these 27 studies, just one of them showed a very slightly higher IQ with a higher exposure to fluoride, and 26 of them showed a lower IQ associated with a higher fluoride. And in an aggregate, it showed a difference between the averages for high fluoride intake and low fluoride intake of 6.97 IQ points. Now that's a big hit in IQ. That would amount to, in a population with a normal distribution of IQs, of maybe 2% or something, so that you would move 2% of people from the genius category into the ordinary category, and from the ordinary category into the people who need social and medical services because they're I think the psychologists use the term in the retarded group or something like that. So that's a serious business. In addition, we have what might be called evidence of plausibility, because there have been studies on animals and on aborted fetuses that have shown effects of higher fluoride on the histology, the cellular structure of the brain. And also in rats, we've seen behavioral changes. And there are studies that claim to show association of fluoridation with higher levels of crime and disruptive behavior and so on. But anyway, in aggregate, there are laboratory studies and epidemiological studies that are highly suggestive that fluoride is affecting the development of the nervous system. For me, there's no question that in general it's affecting the development of the nervous system. In addition, in fluoridated jurisdictions are higher lead content in the blood of children than where there's not fluoridation. And lead is clearly a serious toxin for neurological development. There's no question about that. So, and when we have some plausible explanations of how that higher lead gets there. Anyway, a little bit of a sidebar to the issue, this IQ studies is this. In fact, it was the same medical officer of health who gave us that misinformation on osteosarcoma, who said that this meta-analysis gave a difference of a lowering of half an IQ point from the higher exposed group. Well, either he just read a news release made from the Harvard School of Public Health, which made a mistake and said that. It was later corrected on their website by saying that's not what it meant. It meant that there was a 7%, this corresponds to a 7 IQ point change. Well, if he just was depending on a news release on a website, that's hardly fulfilling your responsibilities as a medical officer of health. That's not the way you get information on such issues. You get information on such issues from legitimate research, good research that appears in peer-reviewed scientific publications. But in addition to maybe he did read the paper and just didn't understand it, because that change minus 0.45 was minus 0.5 of the standard error. The standard error is a technical term from statistics and statistical analysis, but it corresponds to 6.9 IQ points. Now he made this statement in front of a public meeting and all of the council members in Red Deer, Alberta, and he was told that he made that mistake and he should correct it. And he said, "Oh, I'll consider it," but he chose not to correct it. Now that's not honest, and he's dealing with people's public health and the whole province. There ought to be a higher standard of behavior here.
How do you spell that person's name?
I didn't give you his name. I can give you his name, but I don't know that would be fair to do. Anyway, he's not the only one who's done that sort of thing. As a dental officer of health, who I've appeared with several times in testifying before councils, who claims, for example, that the York Review, which was published in 2000, shows that fluoridation was safe and effective. that was so often said by the promoters that a few years after that was published in 2000, that the Professor Trevor Sheldon of York University, who supervised the work of the panel that did the panel of experts on evaluating these kinds of studies, they concluded that there is not sufficient evidence to say that fluoridation is effective in preventing cavities. And they said that there is not sufficient evidence to say that fluoridation is safe. And so these promoters over and over, they say it showed that it was safe and effective. Well, this dental officer of health should know better, because I told him myself 3 times, and I sent him a statement from Trevor Sheldon regretting the fact that promoters were misrepresenting the work of the York Review. Well, anyway, I don't like to attack my colleagues and who are, medical colleagues, but they have responsibilities that I don't see them as fulfilling, and it affects people's lives. So anyway, there were other things you wanted.
Did you mention comments about allergies?
Oh yes, allergies. You see okay, I don't know much about this. By the way, I should say that I am a physician, but I'm also a biophysicist, and my research career in teaching has been in basic sciences, in biophysics and so on, and I don't keep up with clinical medicine, and I'm not licensed to practice medicine, so I'm not giving you medical advice. But I do know something about evaluating scientific papers and so on. So about allergies, what it used to mean anyway, it involves the immune system, and in reactions to substances that are ingested or rubbed on your skin or something of that sort. The word is used more loosely, I think, about people who are arguing over fluoridation, and I'm not convinced myself that there are any allergic effects in this classical meaning of allergy. But there are people, it seems, who are particularly sensitive and rapidly sensitive to exposure to fluoride. And their symptoms are varied and sometimes quite severe, and involve the gastrointestinal system and the respiratory system and so on. In these cases, there are not really any systematic studies of those on a large scale, but hundreds of people have been looked at carefully. And one of the ways that this has been handled is, in particular, I think it's Dr. Walbot, who was practicing in Michigan or somewhere in the United States in the 30s and 40s, and he had a number of cases like this. And what he and some other physicians have done in these cases, after getting the informed consent of their patients, they would instruct them about their diet and their water sources and so on, so that they eliminated as much as possible the ingestion of fluoride, and their systems went away in a matter of weeks. And then they would go back to their ingestion of fluoride, and those symptoms would come back. And they didn't know when they were going to be. This was blinded they didn't know when they were going to get re-exposure to fluoride, so they couldn't be expecting it. And then they just stopped again their exposure to fluoride, and their symptoms would go away. So that's that's fairly convincing if you see that routinely, uniformly among that group of people. And that exists, and it deserves considerable more research And that brings up a very general point here, because the arguments of most promoters, like some of these people, even medical officers, health in Alberta, say, yeah, that deserves more research. Well, why? Why does it deserve more research? Because we're not sure, or he's not sure. I might be sure, but anyway, we're not sure. Okay? So what's a reasonable thing to do? The reasonable thing to do is to avoid the exposure until you know it's safe. But what they're advocating is, if we aren't sure, we'll keep doing it to you until somebody, and nobody in Canada or the United States really is trying to investigate this, until somebody shows us incontrovertibly that it's doing harm. Well, that's backwards, isn't it? You hold off until you're sure it's safe. You don't keep doing it until you're sure it's not safe. So, and that applies to whatever particular toxic effect you might be questioning here. So what else now?
If I understand correctly, I mean, what's most understood is like the bone issues, the fluorosis, and the thyroid. Those are the three strongest areas, right?
Yeah, dental fluorosis, hip fracture, thyroid suppression. And those are three, and there are other effects that are pretty clear. I had written down cancer, and I don't know if that is solid or if you have any. There's some investigators feel very strongly that in some general sense, fluoridation is associated with higher incidences of cancers of various types, and I don't know. I haven't been able to come to a very strong conclusion on that. And we do know from laboratory studies that fluoride affects genes, and a genetic effect is the underlying process of cancers that causes cells to continually divide out of control and cause the troubles that they cause that way. So there's some plausibility here of expecting some influence on the prevalence of cancers of various kinds with fluoride ingestion.
And I think one point that you didn't touch on is it keeps coming up for us, like it seems obvious that this is true, but it's not. People aren't believing it. But when you have this artificial fluoride, it doesn't. I mean, it stays in your body, like it accumulates in your body.
Yeah.
And I'm just wondering if you have any comments about that, as far as what is the evidence that happens? Because the city council, they just kind of say, well, it runs through your body, which obviously doesn't even make sense to me. But
as I pointed out, about half of what a normal adult will keep in her or his body is, about half of the ingested fluoride a normal person will keep in her or his body, and more so for infants and children. They sequester more, and they're more sensitive in many ways also, and they're in the process of very rapid development of all their body systems. So it's a period of life you don't want to toy with, that and the life in the womb. And let's see, the question was.
Well, I guess I'm asking, I heard the part about the children, and that's good, but I'm thinking about older people or average people, because it's accumulating in your body for 30 years.
Yeah. Okay.
Right? So what effect does that have on, say, elderly people or anybody else? Yeah. It's like adults, right?
Okay, well, we are accumulating all our lives, whether it's natural sources of fluoride or artificial sources of fluoride. We accumulate it largely in the bones. And the studies on hip fracture in particular are fairly convincing. And hip fracture generally affects elderly people. And elderly people have been sequestering fluoride in their bones for a long, long time. Furthermore, elderly people who get hip fracture, go into the hospital and lie in a bed, often don't survive that because it affects all other systems, their immobility, and so on. So it's a dangerous and serious problem. And in another place that it's by the way, the soft tissues of the body, like heart and lung and kidney and so on, the most fluoride in accumulated soft tissues is in the kidney, which is, by the way, primarily responsible for the excretion of fluoride. But another place it's accumulated extensively is in the pineal gland. It's a gland outside the blood-brain barrier, but in between the hemispheres of the brain, that it produces melatonin. This is a hormone that has a lot to do with controlling our circadian rhythm, our sleep-waking cycle, and so on. But it also seems to be responsible for the development of the reproductive system. For example, menarche in girls. Menarche is the beginning of menstruation. So in some very large studies, we've seen that that menarche comes earlier in girls who have been living where they have fluoridated water. It comes earlier by 6 months or so than in girls who are living without fluoridated water. So so that's an area of concern, I think, and it hasn't been investigated in much extent at all in humans. There are animal studies that show huge concentrations of fluoride in the pineal gland, thousands of parts per million, whereas in the water you drink, you're getting 1 part per million or something like that, and so it's another area where we need more research, and another area where we should not do it until we're sure we can do it safely, and there are a number of such areas.
You probably don't want to answer this question because it's a psychology question. And that's okay if you don't want to, but I have people telling me cognitive dissonance and cognitive reconstruction, just because it's kind of like, well, what is it that they won't look at the evidence? It's like there's a barrier there, and I don't know.
Okay, so we're getting into the question: why do we do it? How did we start? Why for all these years, over 50 years, that city council and the dentists in particular, it's like they're protecting their whole industry, but it's almost like a subconscious thing that's going on. Like, I don't think that they're evil people or anything. They just, it's like a mass hallucination or something. And well, okay, I always caution that the problem is it effective? Is it safe? Is it ethical? Now, in 2013, but people are curious, understandably. Well, how did we get started, and who's promoting this, and why? Well, I can't say why these medical and dental officers of health I've dealt with take the view and the attitude that they take, because I can't get into their minds, but I can see the consequences of their doing otherwise. They probably know that if, for example, if a medical officer of health in Alberta Health Services comes out publicly and says fluoridation should be stopped because it's not safe and it's not effective and it's not ethical, they might lose their job. Well, I don't have such a job, and so it's easy for me to say that I think if I were in that situation, I wouldn't think my job was so important, balanced against the harm that we might be doing here. And but anyway, that's a powerful motivation to keep your income and keep your family well financed and be able to support your children in university and so on. But I think if they all informed themselves on fluoridation and came out and said, look, we've been wrong. And that being wrong is another big factor psychologically. None of us likes to say we were wrong. And I think that's especially true of physicians and probably dentists. But we have a history of having been seriously wrong lots of times. And I can give you many examples, and serious examples where people were dying or there were grotesque birth deformities and so on, in the thalidomide case, and people were still saying, oh, it's okay, it's okay, it's okay, because they didn't want to say they were wrong. And the people who sell drugs, of course, don't want to say that our drug is killing people or causing the birth of deformed babies and so on. But they're just saying, well, our getting rich is more important than the health of people, and that's unacceptable. The way it started, back in the 1930s, was because the industries that were under attack for having caused serious events where fluoride did serious damage were being sued. And they wanted those lawsuits not to succeed, of course. So they wanted fluoride to have the reputation of not only being harmless but being great for us. And so the industries created a lawyers' committee for fluoride, and they did all kinds of things and pretty dirty things, and they recruited scientists who were dishonest and suppressed their findings of harm and promoted fluoridation and so on. I hope this is an extreme example, but Harry Hodge was a toxicologist who he was the chief toxicologist for the Manhattan Project, and in addition to those industries that were like aluminum production and so on, steel production, there was another interested party, and that was the United States government, because in the enrichment of uranium to produce atomic weapons, they very extensively use fluoride, and they didn't want to be troubled with lawsuits either. And so Hodge was his ethical stance can be measured by the fact that he injected radioactive uranium and plutonium, or had them injected into people without their knowledge, without their consent, to see how much it would take to make them sick. That's no different than what was revealed in the Nuremberg trials about the Nazi doctors who were experimenting on captives. So, but I don't think that exists now. I think now it's just that it's been around so long and been promoted so long by people who aren't so vicious and evil, but just are ignorant and think, oh, well, everybody agrees, well, I guess I'll agree too. And if you don't agree, then you get a lot of guff. Instead of getting an intelligent discussion, when some of us we oppose fluoridation, instead of having the promoters engage us in an intelligent discussion, comparing evidence and so on, they just say, oh, you're a conspiracy theorist, you think that it's being put in our water by aliens from another galaxy and all that stuff. Well, that's just a diversion. and that's worse than irresponsible. And it makes it very difficult for us to get an intelligent discussion, because people don't want to listen to us. They put us all in one category. And we've got to overcome that. Oh, by the way, we are overcoming that. I think one of the things that's not very widely recognized is that the effort to stop fluoridation is winning. It seems to be slow in most people's eyes, but there are hundreds of jurisdictions that have stopped fluoridation over the last 2 or 3 decades in the United States and Canada. And you can see a list of them with dates and all that. And if you go to the Fluoride Action Network website, it's fluoridealert.org. And they're in Portland, Oregon, for example, which has never had fluoridation. Recently, there was this huge expenditure of hundreds and thousands of dollars by the promoters of fluoridation in a rushed plebiscite. They rushed it because the opponents who didn't have such resources needed more time. But the result was a 60% to 40% rejection of fluoridation in the plebiscite. And most of the recent stop rejections have been by the town and city councils. And so, in a few years we won't have it. And another misconception that's widespread is that fluoridation is widespread. It's not. Most of the fluoridated population in the world is in the United States. And about, I guess, 97 or 8% of the population of Europe is not fluoridated. A lot of the countries had started it in the early days, but in the 70s mostly they rejected it. They rejected it for 3 reasons, and we know because we've consulted the public officials and health officers and so on who were involved. They rejected it because there's no evidence that it's effective, substantially effective. There's evidence that it's harmful, and that it's clearly not ethical. So for various combinations of those 3 reasons, they stopped it. And their teeth are just as good or better than those of the people in the United States and Canada. In Canada, we have a sort of a natural experiment between, say, Quebec and Ontario. Ontario is highly fluoridated, and Quebec, only about 3% of the people now are using fluoridated water. Their teeth are better than those in Ontario. British Columbia mostly has never had fluoridation. Now only about 3% have fluoridation. Their teeth are better than ours here in Alberta. And in Alberta, by the way, we just, in the last 3 years or so, we've moved from having 74% of the population fluoridated to down somewhere in the low 40s. And then there's this business out in Calgary. We stopped in the summer of 2011, and these 2 dentists came up recently with saying, and they see more cavities and worse cavities now than before fluoridation. Well, I don't question their honesty here, but they're just talking about their personal biased experiences in 2 practices, private practices. That doesn't weigh very heavily against the studies of tens and hundreds of millions of people that don't show such effect. And in fact, we have studies specifically designed to answer the question of what happens when a city stops fluoridating. What happens to the teeth of the people living in that city? What happens is their teeth continue to have fewer and fewer cavities than the city that doesn't stop. or they're the same. They didn't change from before and after stopping. And those are systematic studies on a large scale. And so I think that we have no concern with those of us who oppose fluoridation, have no concern that we're doing a disservice by getting it stopped. It doesn't cause an increase in cavities.
Hey, just I think I had just one other thing in the beginning when we were outside.
Yeah.
I don't think we have it on tape, but you were talking about Health Canada had a maximum contaminant level of 0, and I was just wondering if you can talk about that.
Well, I don't know whether I said that Health Canada does it, but I think Health Canada, maybe Health Canada, but it's certainly the Environmental Protection Agency in the United States has a maximum contaminant level goal of 0 for arsenic, for example, and lead and so on. There's the distinction between a maximum contaminant level goal and the maximum contaminant level is that the maximum contaminant level is a requirement and has legal implications. But a goal, which will inevitably be lower, if not the same, is something that you think we should have, but is impossible. Either it's impossible technically, or it would be such a tremendous economic burden that it mustn't be implemented because there's some benefit for whatever you're talking about. So there's a level at which you aren't ready to sacrifice that benefit, just because of the economic consequences. So anyway, the goal is reflects what we think about the safety of something. By the way, I mentioned the Environmental Protection Agency in the United States. They don't control this like the FDA, the Federal Drug Agency, but they do scientific studies. So they have several thousand scientists, and those scientists are unionized, and their union took a position against fluoridation.